Hello. Every now and then I come across people with migraine for whom their medications have stopped working. They tell me nothing they take for their headaches works anymore. Be it paracetamol, be it ibuprofen, be it naproxen, even triptans, that everything they take has stopped working for their headaches, and they are quite frustrated about it. Some of them, when they get headaches, they land in the emergency room because everything they try stopped working. For some of them, these medications were working in the past and now it's stopped working. So I hear this time and time again: oh doctor, nothing is working for my headaches. I've tried every pain medication. This is what I want to address in today's video, and if that sounds like something you're interested in, do stay till the end, and don't forget to subscribe, share with others, leave your comments behind. I am Dr. John Oluwole. I am a neurologist, and on this channel I share essential information and things I observe in my day-to-day practice as a neurologist. These are essential tips that help everyone to better take care of themselves. So today I'm centering my presentation or my this on headaches. So like I said, very many times I see these kinds of patients for whom their medications have stopped working, and I help them go through and analyze and find why it's the case. So I think it boils down to two things I'm going to summarize in this video, and the first has to do with the timing of usage of these medications, and the second has to do with taking the right dose of these medications. So now let's elaborate on the first point, and that has to do with the timing of the medications. The point is, a lot of these medications, if taken at the right time, work. So very many of these patients, when they come to see me with these problems, they're expecting me to now prescribe them something else, another medication of a different class that will help their headaches. And at the end of the consultation, I end up still sending them back on the same medication, but now enlightening them on the best time to use these medications in order to get benefit out of them. A very common problem I realize is very many patients are afraid to use these medications at the right time because they often say they don't want to take too many medications. They think it's going to harm their bodies if they use medications, and therefore when headaches begin, they wait to see whether it's going to turn out to be a migraine or just an ordinary headache which they can bear and not have to use medications for them. And what I ask them is, at the end of the day, what's the benefit in waiting to see whether this headache will turn out to be a severe headache or will just remain a mild headache which they can bear and just go through it with the rest of their day? And we eventually realize the fact that there is no wisdom in waiting it out. The analogy I give in the clinic is, imagine a fire breaking out in your kitchen. Would you actually wait to see whether this fire is going to do damage, or you would try to put it out as quickly as possible? The point is, if you allow this fire to go on, it might eventually become a wildfire that you may even need the entire fire service to help you put out the fire. And it's the same with your headaches if you have migraine. So when the headache is starting out, it's only a very small proportion of time that you would see the headache starting out at a very severe level. Most of the time it starts gradually and builds up over time, sometimes up to 1 or 2 or 3 hours after the headache begins, then it becomes severe. to the point where if you now take your medications, it stops to work and you may end up in the emergency room because you're vomiting or the head is pounding and nothing is working. So the first point is these medications that you use as your rescue medications or your acute medications, as we like to call them, should be taken early. And what is early? Usually I say as soon as you become aware of your headache beginning, you should take that medication that your doctor has approved for you or prescribed for you as your rescue medication. So whichever one of them it is, so usually I would say within the first half an hour you should take it. So in that way it's more likely going to work. But when you leave the headache and it becomes severe and you're starting to use your medications, then it may become very difficult for the medication to work. And then the other complaint is that they don't want to take too many medications. Like, okay, if you're going to have to take these medications for all headaches, you might end up taking too many of them. And when you ask them in the clinic to analyze how many headaches they get in a month, you're surprised. Some of them get 4 or 5 headaches a month. So you're not at risk of overusing these medications at all at about 4 headaches or 5 in a month. When you start to get more than 5, heading towards 10, then we'll start to think of putting you on preventative medications. But I usually encourage my patients to treat every headache, however mild it looks, because it might eventually, if you leave it, it might eventually escalate and become something severe that will be difficult to manage. And leave the rest to me. Just chart your headache diary. If you have concerns that you're probably going to be taking too many headaches, then chart it, create a diary and take it to your doctor at the end of the month or 2 months, let them see how many you're taking in a month, and then they can help you create a solution to help you bring the numbers down so that you would not have to use too many medications. Then number 2, the second reason why these medications don't work is because a lot of people use them the wrong way. So when your doctors prescribe you an acute medication, it behoves you to make sure you ask and understand how many tablets you need to take, of each medication per time. And, if you don't get a response or the response is minimal, how long should you wait before you repeat the medication? So these questions are very important. I'm going to talk about Panadol for instance, or Paracetamol. So that's about the commonest one that people use. Most of the time, whatever type of Panadol you're using, be it plain Panadol or Panadol Extra or Panadol Migraine, all of them have got paracetamol in them, sometimes with other medications that help to improve the efficacy of the medication. Like maybe sometimes they're combined with caffeine or combined with aspirin to make up either Panadol Migraine or Panadol Extra. So most of this paracetamol containing solutions would have only 500 milligrams of paracetamol. And I see a lot of adults come into the clinic and I ask them, so how many of these tablets do you take each time you get a headache? And they say, I take 1 because I want to take the barest minimum. I don't want to take too much. And I realized that 500 milligrams is just too small for them. Sometimes it works, but a lot of times it wouldn't work because it's underdose. So for paracetamol or paracetamol containing rescue medications, the effective dose for adults would usually be 1 gram per time, which is 2 tablets per time. And that's how it works. But if you're ever confused with whichever one you're taking, ask your doctor for the adequate dose and how often it should be repeated. For paracetamol containing medications, usually we don't want to repeat them until after 4 to 6 hours. So these are some of the things you need to pay attention to. I do hope this helps you improve your headache management so that you visit the emergency room less often. And if you have questions, you can put them behind and I'll try to address them. Thank you for watching today, and I hope to see you again next time. Goodbye.